We're breaking down E. coli pathotypes, one of the most important and most misunderstood topics in veterinary bacteriology. E. coli is everywhere. It's normal flora, it's an opportunist, and certain strains are true pathogens with very specific virulence factors. By the end of this session, you'll be able to look at a case, calf diarrhea, piglet edema disease, dog UTI, poultry coli bacillosis, and immediately know which pathotype is involved and why. E. coli strains are harmless commensals living in the gut. They help with digestion, vitamin production, and maintaining a healthy microbiome. But certain strains have acquired virulence factors, toxins, adhesins, secretion systems that turn them into true pathogens. These are the pathotypes we care about clinically. So the key message is E. coli is not one organism, it's a whole spectrum, from harmless to highly pathogenic. These are the 6 major pathotypes you'll encounter in veterinary medicine. Each one has its own virulence factors, its own disease patterns, and its own preferred host species. Once you learn the patterns, they're actually very intuitive, and they explain why certain diseases look the way they do. EPEC is the classic cause of neonatal diarrhea in calves, piglets, and lambs. The key virulence factors are fimbriae, little protein hooks that let the bacteria attach to the small intestine. Different species have different preferred fimbriae, which is why vaccines are species specific. Once attached, the ETEC produces enterotoxins, heat labile, LT, and heat stable, ST, that cause secretory diarrhea. Importantly, ETEC does not damage the intestinal lining. It just turns on the quote water pump. EPEC causes diarrhea by physically damaging the intestinal epithelium. It forms attaching and effacing lesions. The bacteria sit on the enterocyte surface and destroy microvilli. This leads to malabsorption and osmotic diarrhea. Unlike STEC or EHEC, EPEC does not produce Shiga toxin, so the disease is usually milder and more chronic. It produces Shiga toxin, one of the most potent bacterial toxins we deal with. In pigs, STEC causes edema disease, typically in recently weaned piglets. The toxin damages blood vessels, leading to edema in the eyelids, stomach, and brain. Clinically, you may see neurologic signs, ataxia, or sudden death. This is a high mortality disease if not caught early. EPEC combines the worst of both worlds, Shiga toxin and attaching and effacing lesions. Cattle are the primary reservoir. They carry EHEC without showing disease. This is why EHEC is such a major food safety concern. In humans, EHEC can cause hemorrhagic colitis and hemolytic uremic syndrome. In animals, disease is less common, but the zoonotic risk is huge. APEC is a major pathogen in poultry. It causes coli bacillosis, a systemic disease that often starts with respiratory infection. Birds may develop air sacculitis, pericarditis, perihepatitis, or septicemia. APEC strains are interesting because they're opportunist but also have specific virulence factors that make them more aggressive than normal gut flora. UPEC is the #1 cause of urinary tract infections in dogs. These strains have adhesins, especially P. fimbriae, that allow them to stick to the uroepithelium and ascend the urinary tract. Recurrent infections often involve underlying issues like endocrine disease, anatomic abnormalities, or biofilms. Is your quick reference summary. Each pathotype has a signature disease pattern, a signature set of virulence factors, and a signature host species. Once you memorize these patterns, E. coli becomes one of the easiest bacterial groups to understand. Culture alone cannot tell you the pathotype. You need virulence gene detection, usually PCR, to identify toxins, adhesins, or secretion systems. Serogroups can help, but they're not definitive. The key point is pathotype is defined by virulence factors, not by species or serogroup. Treatment depends on the disease. For neonatal diarrhea, supportive care is the cornerstone. Fluids, electrolytes, warmth, and nutrition. Antibiotics may be indicated in septicemic animals, but routine use can worsen resistance and disrupt the microbiome. For UTIs, culture-guided therapy is essential. Prevention focuses on reducing exposure and improving immunity. Colostrum management is critical for preventing neonatal ETEC. Vaccines exist for some pathotypes, especially ETEC in pigs and APEC in poultry. Good hygiene, clean housing, and minimizing stress all help reduce disease. To wrap up, E. coli pathotypes are defined by their virulence factors, not by their name or serogroup. Each pathotype causes predictable disease patterns in specific species. Diagnosis requires molecular testing, and prevention is far more effective than treatment. Once you understand these patterns, E. coli becomes a very logical and manageable group of pathogens. If you found this video helpful, please like and subscribe. Thanks, and I'll see you next time.